Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, November 16th. We invite you to submit your questions via Facebook at any Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Great. Thank you, Sophie.
In the United States, yesterday, we saw roughly 33,000 positive new cases with a 2% increase over the last 7 days, with their 7-day average being at about 39,000 positive new cases. Hospitalizations have increased by 2%, and fortunately, the death rate in the United States has decreased by 15%. In Illinois, yesterday we saw 1,891 cases, but the day before we saw close to 7,000 positive new cases. So while there has been a decrease of cases by 8% over the last 14 days, there was a massive spike roughly 2 days ago. Hospitalizations have decreased by 3%, and the death rate in Illinois has decreased by 15%. Okay, so talk to us about this winter surge coming along, Dr. Murphy. Like, should we expect it? Should we not expect it? What are these numbers showing us?
Well, what these numbers are showing up is this kind of slightly declining amount of cases, particularly in the severe cases. Death rate is now per day in the low 300s. So all that's an improvement. It's not like a super dramatic improvement. Remember that if you extend flu over a whole year period, it's 100 deaths per day. All right, so we're not even down at the flu level yet. And 300 cases a day is like 10,000 cases, 2,100 cases per week is, close to 9 or 10,000 deaths, per month. That's, between 100, 120,000 deaths per year. That still puts it way up in the top 10 causes of death in the United States. So, it's better, but we still have a ways to go. And there's things we can do to protect ourselves. The most important is staying updated on your vaccines. And if you do get sick, if you're over 50 or you have any underlying immunocompromised condition, any kind of chronic medical illness, actually, which is about a third of the population, you should take one of the treatments, and the best treatment is Paxlovid. It's a combination drug made by Pfizer, still given out by the pharmacies now. Plenty of supply. It's underutilized. That, whether you're vaccinated or not, or updated on your boosters or not, works, prevents even more hospitalizations and more death. So if you do all those things, this thing is going to come down. So we just have to face it. And this is just the way things are going to go on. Now, this winter surge, typically we do have a winter surge about now, starting now, usually more towards the end of December. And in the Southern Hemisphere, which of course is, they're having their summer when we're having our winter, they did have a big surge after Christmas. It didn't get up as high as the surge from last year, but it also wasn't as bad, and it came down quicker. So we'll see what happens in the United States. We're a very heterogeneous country and a very large geographic country. So it remains to be seen, but everybody is expecting the surge, and we're seeing lots of the other stuff out there, lots of flu, lots of respiratory syncytial virus, also referred to as RSV. And those are causing really almost as much havoc as COVID. And altogether, it's not good. So, we're going to have this surge in the winter.
Yeah, absolutely. And, going into our first COVID headline, which ties directly into a lot of these statistics, is, has COVID morphed into a new kind of fatal disease? Death and hospitalizations are falling in the US. So what can you tell us about what's going on with the flu and RSV?
Yeah, so COVID is always mutating. We now are dealing with the subvariants of BA5, mostly in the United States, which is whatchamacallit, it's BQ11 and other subvariants. So it's changing. And because they're taking over, that means that they replicate better than the original one. So it continues to evolve. Now, the good news is that it's not evolving into anything more serious. It's evolving into something maybe a little bit milder. Plus, all the immunity that the population has gained from either getting COVID, getting a vaccine, getting multiple vaccines, or getting both or all right? So that part is good. It is sort of changing, and we're getting into more of this endemic state. But because our mitigations were so good in 2020 and 2021, we didn't get a lot of exposure to the other respiratory illnesses like flu and respiratory syncytial virus. So those are coming back with a vengeance, especially in people that hadn't had it before, like in young kids. You know, they missed getting the flu and RSV for a couple of years there. So now they're getting them big time. I mean, flu this year, if you look at the statistics, it came early this year. It came at least 6 weeks early. There's over 900,000 cases, probably even more, because a lot of it doesn't get diagnosed. It's already accounted for 7,000 hospitalizations and 360 deaths, including 3 in children. And the vaccine uptake, which is still going on now, 128 million people have taken the vaccine. We got to get, that's too low. That has got to come up. So, you know, that's a way you can protect yourself. So the flu vaccine works at least 50%. You know, that it can make a big difference at the population level. Now, if you look at the pediatric uptake of kids are supposed to take the flu vaccine too. So if you look at their COVID vaccine uptake, it's very low, only about 10% or so. And if that got up to 50%, the estimates are that would prohibit or decrease 38,000 hospitalizations. 38,000 hospitalizations is a lot, all right?
Yeah.
And if we got that rate up to 80%, which would be great, we would not have 50,000 pediatric hospitalizations. So those numbers are enormous. And as we've talked about before, the pediatric beds are pretty full with all these sick kids. And the best way to prevent that is to have them make sure that they get the COVID vaccine and make sure they get their new flu vaccine.
Yeah, absolutely. Well, okay, going into our second headline, which you talked a lot about already, which is awesome. But wrapping that up is Moderna says a new COVID booster is better against Omicron BA5 and triggers an immune response against BQ1.1. So what can you tell us about Moderna's updated booster?
Well, I mean, this is good news. So, you know, they now, you know, they had the approval just based on the design of the vaccine itself and some laboratory tests. And now they're getting some human data in bigger numbers. And they're showing that the neutralizing antibody response is much higher with this bivalent vaccine. The same is likely true for the Pfizer vaccine, so no big difference, or Novavax. So these redesigned vaccines are working better because they are more specific for the virus that's circulating today. So it's good news, and we'll continue modifying these vaccines probably at least once a year, just like we do the flu vaccine. The flu vaccine is modified every year, and so all that's good news.
Wonderful. And then going into our third and last headline is COVID depression is real. What do we know as of right now, Dr. Murphy, about this?
Well, it's been clear from the beginning that the pandemic has been incredibly stressful for all sorts of people, all walks of life, and that it's been very disruptive, very depressing for many people, and people are suffering from this depression. remember, it's always good to remember that depression is a very treatable disease. It's a disease, and it's treatable. So make sure if you know someone or you are yourself depressed at all, that this can be treated. And the treatment rates for depression are incredibly successful. The medications and the therapy, whatever is prescribed, I mean, it's like at least 80% successful. And it doesn't necessarily have to be for life or anything. You have to get through these particular stressful episodes and learn how to deal with kind of the new way that we have to live. Let's face it, things have changed. Schools were closed down. There was all this remote communication now. Jobs have changed. People are not back in the office like they used to be. I mean, maybe half. There's stress in companies that are forcing people back in. There's stress in people still working at home or in hybrid situations. It's just, everything is just upside down now. And let's just face it, things are going to be different from here out. And so there should be no surprise. It's there, it's real, and it's treatable.
Yeah, absolutely. Well, going into our first COVID question is one I feel like everyone's been talking about is, Dr. Murphy, is it possible to get the flu and COVID at the same time?
Absolutely. You can get the flu, COVID, and RSV at the same time. I mean,
Yeah, that sounds horrible.
They're all spread the same way, and they're very different from each other. The one doesn't protect you from the other. The reason why the flu went down in 2020 and 21 is not because there was so much COVID. It was because of the mitigations that we did. In other words, everybody was wearing a mask. People were social distancing. Group gatherings were limited in many places, not all places, but in many places. So you put all that together and the flu and RSV went way down. COVID went down too. It works, but now those social mitigations, are pretty much lifted. I mean, there are still places where you go. I've been in a few theaters recently and they require masks. There's other places where masks are required. Some companies require it, but it's very piecemeal. And just most people are just out there. So remember, when you're outside, you pretty much don't have to wear a mask. But if you're in any kind of confined area where there's not good circulation of air, you're going to be at risk. I mean, so many people are getting COVID now, and these numbers that you're reporting are so underreported because a lot of people aren't even getting tested. And because of all the immunization you have, in other words, all the vaccines and prior COVID, you may have a very mild case. You don't even think about getting tested. And the only tests that are getting reported are the ones done in certified laboratories, not the home tests. Those are not reported. So anyway, there's a lot of stuff out there right now.
Yeah, absolutely. And going into our second and last question is, well, you touched on this before, will there be a winter surge and how will the cold weather affect the winter surge? I wanted to ask you, Dr. Murphy, should we be worried about family members coming in from out of town, both domestically and internationally?
Yeah, all that's true. We've sort of touched on it already. The surge is going to come. It comes sometime in late December, early January. That's typically when it comes. And that's going to come with the flu and with RSV. And when you have people moving around, like your child is coming home from college or they're going to visit friends and then they come back, all that kind of movement, you're going to move the viruses around the population. So you have to be careful. So the ones at most risk, of course, are elderly, particularly if they have underlying medical diseases. If you look at the death statistics, it's approximately 2/3 of the deaths are people 75 and older with underlying diseases. But then, so that's 2/3. Well, 1/3 is below 70, and most of them have some kind of other high-risk condition that is putting them at increased risk. So yeah, all that, any kind of movement is always risky. So, the important thing as soon as somebody gets any kind of symptom, and the symptoms are pretty vague, and they can't distinguish between flu and COVID and the other diseases. Sore throat, runny nose, headache, little fever, all that stuff is so vague. It's common with all of them. Get one of the over-the-counter tests and test yourself and see what you have, because then you can take yourself out of the transmission line.
Right.
Isolate yourself and be careful. Just wear a mask. It doesn't have to be, complete quarantine, but you can stop the chain of events there. Plus, anybody you expose, they don't have to quarantine or anything like that. But as soon as they get sick, they need to get tested. And if they're positive, the same type of preventive measures should be put in place.
Yeah, absolutely. Well, Dr. Murphy, those were all of our COVID questions for today, and we will see you next Wednesday.
All right. See you Wednesday. Have a great weekend.